Hi YouTube, this is Francesca via Breastfeeding Mamas. I noticed there hadn't been a video done on this channel in a while, so I was going through our video requests and I found a request for teething while nursing, so that's what I'm going to do today. I didn't know exactly what you meant in terms of teething and nursing, but I'm just going to try to cover as many things as I think would be relevant to nursing. So, first thing I want to say is a lot of times you'll hear, oh, your baby has teeth and you can't nurse when your baby has teeth, or your baby is getting teeth, don't you think you've nursed long enough? And that's absolutely false. You do not have to stop nursing just because your baby has teeth. If your baby's latched on correctly, you should not be able to feel the baby's teeth even when they have a full mouthful of teeth. It should not affect nursing at all. Also, if you nurse while your baby gets teeth, it can actually help to promote proper teeth alignment and proper jaw development. So nursing can actually help them to have a nicer smile later on in life, so you definitely do not need to stop nursing just because your baby is getting teeth. Okay, so basically, if teething is going to affect nursing, one of two things is going to happen. Either your baby will want to nurse all the time because, you know, they're hurting and they want comfort, so they want to nurse constantly. Or your baby doesn't want to nurse at all because it hurts and, you know, their gums hurt when they suck and they just don't want to nurse. So to address either of those things and to try to get your nursing patterns back to normal, you pretty much want to help to alleviate the baby's discomfort and to try some things that can make teething not hurt so much for them. So a couple things that you can try. Obviously the most obvious thing is to use some sort of suspension liquid medication, Advil or Tylenol. The generic brand names, if you want to buy like store brand, are Tylenol is acetaminophen and Advil or Motrin is ibuprofen. I personally like ibuprofen better, especially for teething pain, because it has an anti-inflammatory, so it works a little bit better and it lasts longer, so you don't need to give it to the baby quite as often. So if you don't like the idea of that, or you just want to save it for at night when the baby's waking up all the time, you can just try some other things as well. One of the things that you can try is some homeopathic remedies. I know these have become very, very popular lately. You can get a homeopathic teething gel. The tablets that you used to be able to get, at least the kind that I used, have been temporarily discontinued so that they can standardize their formula. But you can get the gel, the kind that you put on their gums. And you can also use actual specific herbs. Some herbs that can help with teething are Camilla, calcarea, belladonna, clove oil. I think that's all. I used the teething tablets, and the teething tablets had belladonna and Camilla, I think, in them, and they worked really, really well. Also, when I had my wisdom teeth taken out, I had a dry socket. Holy crap, dry sockets, if you've ever had them, they hurt really badly. And when I went to the dentist to get it fixed, they put some clove oil on it, and it helped a lot. Like, it made such a difference. As soon as they put it on, I felt way better. So those are some homeopathic things that you can try. I'm not an expert, so when you go to get the homeopathy, you want to ask somebody the correct dosage for your baby and everything like that. A lot of times cold can help to sort of like numb the pain on the gums. So some options for giving your baby something cold is obviously one of those teethers that you can put in the freezer or the fridge and they get cold. Frozen washcloths, just wet the washcloth down and then put it in the freezer. If your baby's old enough, you can freeze some fruit, like pretty much anything. I don't know, bananas are a good one. Freeze some bananas, or and then put them in a mesh feeder. Just so that your baby doesn't choke or anything like that. They can sort of gnaw on that, and that can sort of help. You can take a spoon and put it in the freezer, and sometimes babies like to chew on that. Another thing, as far as teething toys are concerned, you can get vibrating teething toys. That sometimes helps babies. My older daughter was a big, big fan of the vibrating teething toys. My younger daughter doesn't really like teething toys that much. She kind of just likes to chew on her fingers. But if your baby doesn't like one kind of teething toy, try a different kind. Some babies will have one specific teething toy that's just like a miracle. So, keep trying and don't despair if your baby rejects the first one that you get for them. Another thing that I really like to do, I haven't really heard of anybody else doing this, but I found that my babies really like to be, held and comforted and stuff, even if nursing hurts. So it was nice for them to be able to be held in like a nursing position, like the cradle hold, or however I would normally hold them to nurse. And I would wear a necklace, one of those mommy necklaces that has like the bits that baby can grab and chew on, and that really helped them to be held even if they didn't nurse, to be held like they were nursing and to be comforted that way, and to be able to chew on the mommy necklace to help to get some discomfort from the teething. So that's something else that you can try. Another thing I wanted to say is some people like to use baby Orajel, the kind that you put on the gums and it numbs their gums. Some people are really against baby Orajel and they don't think that it should be used at all. I personally think if it helps your baby, go ahead, use it. But you shouldn't use it right before you want to nurse, because what can happen is you put the stuff on their gums to numb it, and it can go back onto their tongue and it can numb their tongue. And babies need to use their tongue to nurse properly. They need to use it to compress the breast. So if your tongue is numb, that's going to be kind of difficult. So I don't recommend doing that right before you nurse, using the Orajel right before you nurse. Okay, so now as far as biting is concerned, there are a couple things you can do to help stop biting. A lot of people have said to me, yell out, scream in pain, and baby will get scared and, stop biting you. I don't really like to do that because I don't want my baby to associate, being scared with nursing, right? When my first daughter bit the first time, I screamed. I did. I was like, oh my God, because, it hurts. It's painful. But I don't think you should really do that on purpose. What I like to do instead is to unlatch the baby and release the baby because they're biting down, and say, no biting, be very firm in your voice, and then if the baby does it again, put the baby down on the floor. That way, instead of associating being scared with nursing, the baby will associate, oh, I bite and I don't get my milk, they'll associate biting with no booby, and then they'll stop. If your baby's a little bit younger and that doesn't work quite as well, I know Lorelai bit me at like 4 or 5 months, and when I unlatched her and said, Lorelai, no, she just laughed and thought it was funny. So if your baby's younger and that doesn't work, what I do with Lorelai is I pretty much just bring her face into my breast, and then she can't breathe through her nose and she needs to release to breathe through her mouth. I obviously don't cut off her oxygen supply or anything like that. I bring her nose into my breast. She unlatches right away. It's pretty much instantaneous because they need to breathe before anything else, and that helps her to stop biting. So that's what's worked for me. I hope some of that stuff is helpful for you. If anyone has any questions or any requests, if it's specific to me, you can leave it in the comments for this video and I'll see it and I'll do a video for you. If you want something from one of the other ladies, I know there was a request for nursing with big breasts, love to help you there. Can't really because I don't really have any experience in that area. But, so if there's things for other ladies, leave them on our channel wall. We'd love to have some video ideas. So I hope that everyone has a really great weekend and hope you liked this video. Thanks for watching. Bye.